Hello everyone, my name is Diana Escobar. This is my project presentation for Human Understandings on Bacterial Pathogens for Professor Poffenroth at San Jose State University. We'll be talking about bacteria first of all. So what are bacteria? The Oxford Dictionary definition is a member of a large group of unicellular microorganisms that have cell walls but lack organelles and an organized nucleus, including some that can cause disease. Those are the pathogenic bacteria, which we will be talking about later on in the presentation. That definition is very long, but essentially it is a bacterium is a singular microscopic cell. It has firm cell walls, no organelles or nucleus, various shapes and sizes, such as those seen in the image to the side. The coccus, Coccobacillus, Vibrio bacillus, Spirillum, Spirochete. And they are rapid in reproduction because they're very, very tiny, and that's just the way that they work. That other image seen to the side is an example of different kinds of bacteria. There are three types of bacterial relationships. They are communalism, mutualism, and parasitic. Communalistic bacteria are the bacteria that is most predominantly found in the human body. This is a type of relationship when the bacteria is harbored in the host but causes no harm or damage towards the host/carrier. So the bacteria is essentially living inside the body but causes no damage. And mutualistic relationship is when the relationship occurs but both the host and the bacteria benefit. This type of bacteria is most commonly found in the nose, the mouth, and the intestines. This bacteria is benefited by having a place to live, and it also benefits the body by not letting harmful microbes and other bad viruses and stuff to live in your body and cause further damage. The final one that we will be talking about is parasitic, which is the main reason for this slideshow. This type of relationship occurs when the bacteria causes illness and infections to the host while they benefit. So they're having somewhere to live and feed off of, but at the cost of the host and their health generally. The old age question: is bacteria a friend or a foe? While bacteria is responsible for many illnesses and infections, they do greatly benefit society. Some of the more common uses is to produce and manufacture cheese, butter, wine, yogurt, antibiotics, and it also helps in the decomposition of sewage and waste. What are pathogens? The Oxford Dictionary definition is a bacterium, virus, or other microorganism that can cause disease. Essentially, a microscopic cell that causes diseases, illnesses, and infections. There are three types of pathogens. Acute is when the pathogen is short in duration and has rapid progression. This is just very quickly passive and usually leaves within 2 to 3 weeks. The next type is latent. It is concealed, not completely there, though it is there, so it's more dormant rather than active. The final one is chronic. Chronic is when it is constantly recurring, it is long in duration, or it has short returning intervals. What are bacterial pathogens? When you put both bacteria and pathogens together, essentially they are bacteria that can cause infection. They are parasitic, and some examples that we will be talking about are Salmonella, tuberculosis, the bubonic plague, cholera, scarlet fever, impetigo, pneumonia, urinary tract infections, and gonorrhea. Salmonella is a rod-shaped bacteria, usually caused by eating raw or undercooked food. Symptoms include nausea, vomiting, diarrhea, headaches, chills, fever, abdominal cramps, and blood in feces. The treatment usually are antibiotics, which are available, but resistance is increasing in some species of Salmonella as time passes by. Tuberculosis is the next bacterial pathogen that we will be talking about. Tuberculosis is usually contracted through airborne means, such as the nasty ones like coughing and sneezing, but can also be contracted through simple tasks such as laughing, talking, and singing. Symptoms of tuberculosis include coughing up blood, chronic cough, fatigue, chest pain, loss of appetite, and fever. Not very fun. Treatments include antibiotics that combat against TB or tuberculosis. The bubonic plague is generally found in Africa, Asia, and South America, which are third world continents. This is also known as the Black Death disease. It is predominantly found in rats, lice, mice, squirrels, dogs, cats, and prairie dogs. The treatments are antibiotics. Symptoms are very similar to those of the flu. They do also additionally have seizures. Weakness and fatigue, muscle pain, headaches, and the fever and chills. To the right, you see the specimen of bacteria that works in causing the bubonic plague, and the other image also shows a very advanced form of the bubonic plague. Cholera is the next one. It is caused by direct ingestion of feces-infested foods and waters, usually found in third world countries where water is not regulated well, and the irrigation systems are just not the best. Symptoms do include vomiting, dehydration, muscle cramps, and thirst. Treatments are fluid replacement and antibiotics. By fluid replacement, it's like a flush of like medicated fluids that help get the bacteria out of the system. Scarlet fever is caused by the same bacteria that causes strep throat. It can be obtained by leaving strep throat untreated. Coming in contact with people who have strep throat also is a big factor in this because it is highly contagious. Treatments include antibiotics. Symptoms are strep throat, but like a severe case of strep throat, and rash in like the different parts of the bodies. Impetigo is caused by skin infection, often around the mouth. It's caused by infection and coming into contact with people who have impetigo and who do not exercise healthy hygiene methods. Symptoms do include sores, bumps, and blisters that are often very sensitive and itchy to touch. Treatments are available as antibiotic ointments. Pneumonia is predominantly found in elderly people over the age of 50, in sick patients in the hospital, and is also found in infants younger than the age of 1, in smokers and alcohol abusers. This is because all those people found in the category are very weak to their immune systems are very weak and can contract pneumonia very easily. It is an infection to the lungs as seen in the x-ray image to the right. Symptoms do include chest pain, difficulty breathing, fatigue, excessive sweating, and cough with phlegm. It can be treated through antibiotics. Urinary tract infections or UTIs can happen. UTIs can happen as a result of a sexually transmitted disease, but men and women can contract it even if they're not sexually active. Symptoms do include constant urge to urinate, pain while urinating, pink, red, or blood-tinted urine. Treatments do include antibiotics and can clear up within 3 to 5 days. Gonorrhea is a sexually transmitted infection, an STI. In other words, symptoms in men vary from those in women. Discharge from the penis, burning sensations while urinating, and swollen testicles. In women, there is a burning sensation while urinating as well. Abdominal pains and abnormal vaginal discharge, unusual vaginal bleeding. Note, both men and women are susceptible to sores and blisters around the genitals and the mouth, as seen in the example photo to the right. Treatments do include. In summary and in conclusion, most bacterial pathogens can be treated with antibiotics, although some specimens are more advanced than others. The best way and most practical prevention is to constantly wash your hands with soap and water for at least a minute and a half each and every day. Thank you for watching.